Hello everyone. I hope we are doing well and we've been well all this time. So today we'll be discussing the development and also the congenital anomalies of the respiratory diaphragm. A point to appreciate is that this important diaphragm will also try to appreciate some of the gross features of the diaphragm. So what are our objectives for the session today? Our objectives for the session today will be trying to see the gross structure in some of the major openings of the diaphragm and also some of the minor openings of the diaphragm. Also, we'll try to see the development of this respiratory diaphragm, and then we'll also try to appreciate some of the congenital anomalies of the diaphragm. So let's do this. So in terms of the gross anatomy, we know that the diaphragm has three origins. It originates from the xiphoid process of the sternum, originates from the lower six ribs and their costal cartilages, and also originates from the from T12 to L3, the body, and also some of the transverse processes of this lumbar vertebrae. So those are the three major origins of the diaphragm. So for the diaphragm, in terms of the diaphragmatic origin, in terms of the lumbar vertebrae, mind you, they usually come from the right and the left crura, which attaches themselves to the lumbar vertebrae, and also from some books usually say from T12 to L3. Maybe another point of appreciate is that they usually attach themselves at the center through the central tendon. That's where the fibers merge and form the insertion, the point of insertion of the diaphragm. So for the action of this diaphragm, once it contracts, it flattens, bringing in negative pleural pressure that enables now air to rush in. Of course, now with the help of the ribs moving upwards and outwards, now making air to move into the rib cage. For the openings of the diaphragm, you need to appreciate that we'll have the openings of the inferior vena cava, the vena caval opening. The vena caval opening also is actually found on the central tendon of the diaphragm, allows the right phrenic, the branches from the right phrenic now to pass in there. Then the other major opening that we need to appreciate is this esophageal opening. The esophageal opening is found at the level of T10. The caval opening is found at the level of T8. So this esophageal opening allows the esophagus itself, the right and the left vagus nerves, or the anterior and the posterior vagal trunks are found there, and then also some lymphatics. Apart from also having some lymphatics, we'll also have now the structures that supply the left gastric vessels that supply the esophagus. The distal part of the esophagus will also be found there. So T8 caval opening, T10 esophageal opening, and then at T12 we'll have now the aortic opening, and this aortic opening allows the descending aorta, which now starts from becoming the thoracic opening to become the abdominal aorta, from thoracic aorta to abdominal aorta at the level of T12. The other structure that you'll find there is that you'll have the thoracic duct, and then you'll have the azygos vein. So the structures at caval opening, we'll have the vena cava itself and the branches of the right phrenic nerve. Esophageal opening will have branches of the right and the left vagus nerves, or the anterior and the posterior vagal trunks, some lymphatics, and also now the esophagus itself will be found there. Then for the aortic opening, you'll have the aorta itself, you'll have the thoracic duct and the azygos vein being found there. So what forms this aortic opening? The aortic opening, you can see it's being formed by this right and the left crura, the median arcuate ligaments, a point where you can have aneurysms. At which level? T8, T10, and T12 for the caval, esophageal, and aortic opening, respectively. Another point to appreciate is that the easiest acronym that you can use in this is Voice of America. So VOA for the 3, and then you talk about T8, T10, and T12. And then you can also see we have some other minor openings. We have the foramen of Mogagni, which is anterior, just posterior to the xiphoid process, the foramen of Mogagni, which allows the superior epigastric artery and superior epigastric vein. Then we'll have foramen of Bochdalek. This foramen of Bochdalek now is actually a point of hernias together with foramen of Mogagni. This foramen of Bochdalek, foramen of Mogagni. Here you have the various, you have a muscle here known as quadratus lumborum, which now forms a part of posterior aspect of the back muscles. In terms of tissues of origin, we can see like we have 5 tissues of origin, but the first of one of them is this septum transversum, which forms the central tendon. This septum transversum, which forms the central tendon, the pleuroperitoneal membrane, which comes from the sheaths of somatic mesoderm. This is it. Pleuroperitoneal membrane, which comes from the sheaths of somatic mesoderm. The dorsal mesentery of the esophagus. So this is the esophagus, developing esophagus. It will give you some dorsal mesentery that forms the posterior part of the diaphragm. And then the lateral body wall. This is a lateral body wall that now will come and form the peripheral portions, including now the ones that attaches themselves on the ribs. So those are now 4 parts that form majorly the membranous part of the diaphragm. So septum transversum, pleuroperitoneal membrane, dorsal mesentery of the esophagus, and the lateral body wall. And then you'll have now these structures being invaded by occipital myotomes from C3, C4, and C5, which gives us the myoblast that forms the skeletal muscle that invades the diaphragm. So that is it. The occipital myotomes gives us the myoblast that originate from C3, C4, and C5, and that's the reason why the phrenic nerves, their nerve roots comes from C3, C4, and C5. So these are the tissues of origin, and it's important to know there are 5 of them: septum transversum, pleuroperitoneal membrane, dorsal mesentery of the esophagus, lateral body wall, and occipital myotomes. You can be able to appreciate them here. We'll have the septum transversum. This is the esophageal mesoderm, the mesentery. You'll have the pleuroperitoneal membrane, and then in blue we have the lateral body wall. And of course, now it will be invaded by the myoblast from the occipital myotomes. So where is the site of origin? Develops on the neck, so it descends downwards below the developing heart tube and the lung buds. So it's just lateral. It's just found inferior to the developing heart tube and the developing lung buds at this point. So from the region of the neck, descends downwards. In terms of the anomalies, we need to appreciate that you have congenital diaphragmatic hernias, infiltration of the diaphragm, and diaphragmatic tumors. So let's appreciate them in terms of structures. You can see them here. So these are now various hernias. We can have Bochdalek hernias. So you remember you had foramen of Bochdalek here. So you can have now hernias coming through this Bochdalek foramen here. We can have foramen of Mogagni, that is anterior, that can give you hernias coming from the anterior aspects. And then you can have hiatal hernias. Now using now the esophageal hernias, hiatal hernias. So sliding through the paraesophageal hernia. So that is now the esophagus slides into the stomach, slides into the thorax. So these ones can be acquired, can be congenital. In addition to that, now we can have, this is diaphragmatic hernias, congenital diaphragmatic hernias. You can appreciate tissues of the abdomen being into the thorax. Similar case, you can have it here. These are structures of the abdomen. They are found into the diaphragm. So you have now a diaphragm having now foramens and hiatus, which allow structures into the thorax. Of course, now leading to pulmonary hypoplasia, the development of the lungs that you can see here. Pulmonary hypoplasia. Then the last one is eventration of the diaphragm. is the eventration of the diaphragm. Yes, the diaphragm was formed well, but now we had a failure in terms of the occipital myotomes migrating downwards, migrating into this developing diaphragm. And that's the reason why you can appreciate here. We'll have now the membrane is still there. The structures are into the thorax, but they haven't mixed because you have a membrane being present. So this is the eventration of the diaphragm. So that is it, eventration of the diaphragm. The membrane is present, but the structures are not mixed. Eventration of the diaphragm. And then we have diaphragmatic hernias, congenital diaphragmatic hernias. You can see it here. You can see it here. And then all these are the various hernias that can come across. They can be acquired, they can be congenital, bottle leg hernia. You can see it here. Mogami hernias, and then you can appreciate hiatal hernias that happen at the level of esophagus. So with that, I wish you all the best. Kindly like, share, and subscribe. Looking forward to see you in the next videos.